Hello and welcome to the Hormone Genius Podcast. And thank you for all being here today. We are excited to be here to be interviewing Dr. Marguerite Duane. And I know Dr. Duane, we've known each other for probably a couple of years now, I would say. And we were just joking before we started the podcast that we probably talk to each other once a week about medical stuff. And we're working together on some kind of working with medical students. So happy to have Dr. Duane here. She is a family practice doctor, used to be and still currently kind of practicing as a direct primary care physician, but she's had a big life change because she's not in Washington, D.C. area anymore. She's actually in Salt Lake City, Utah, doing a fellowship. So we'll let her tell us about that. But primarily, Dr. Duane started an incredible organization called FACS. And it's always one of those I have to stop and really think about what FACS stands for because it is an acronym, but it's Fertility Appreciation Collaborative to Teach the Sciences. Did I get that right?
Yes, you did.
Okay, so that's the hardest thing for me. I'm like, get the FACS acronym right. But such a great organization that has helped so many people. And for me, I am just so passionate about it because I'm in the medical field. I really think this is what we need in terms of that bridge between our patients who are learning so much, but our doctors don't know it, right? And we have to have our doctors know holistic women's health and understand charting and all this. Otherwise, it doesn't matter if our patients know it. They don't have anybody to go to help them with so many important things, so many vital signs to their health. So Dr. Duane, thanks so much for being here with us today.
Thank you so much for having me. I'm really delighted to be here with you both.
Just tell us, how FACS got started and a little just about yourself, your story.
Sure. So as you said, FACS is the Fertility Appreciation Collaborative to teach the science. And our mission is to educate current and, more importantly, future physicians and medical professionals about the science underlying natural or fertility awareness-based methods and their applications in women's health and their effectiveness for family planning. We actually just celebrated our 10-year anniversary, which is very, very exciting. But FACS itself started through my experiences as a associate professor at Georgetown University. I became a faculty member at Georgetown in 2004. And in 2010, one of my colleagues had reached out to me. At this point, I had become an adjunct professor. I was medical director of community health centers in DC. And one of my colleagues from Georgetown reached out and said, we're looking for people to volunteer to teach small group classes on any topic related to medicine and healthcare that will help make our medical students more well-rounded as physicians. So this was a course for first-year medical students, and I was familiar with the course. I had taught in it before. I taught about breastfeeding and the importance of medical professionals and physicians understanding that topic. My husband and I had co-taught a course on Civil War medicine. And I thought to myself, having an opportunity to teach even a small group of first-year medical students about the science underlying natural methods or fertility awareness-based methods and their role in women's health and family planning is so critical. Because for me personally, I never heard the term charting the female cycle or natural family planning or fertility awareness until I had graduated from medical school and was in my first year of residency. So it was the summer of 2000. I was a first year resident at Lancaster General Hospital in Lancaster, Pennsylvania. And I was on OB call one night, and I was doing what any good intern would do on OB call. I was getting all of my postpartum patients ready for discharge the next day. And part of getting them ready for discharge was doing their discharge paperwork, putting in their prescriptions, and making sure they had birth control on board, before they left the hospital with their brand new baby. Because as physicians, it's drilled into you that's an important part of the discharge planning for new moms. At the time, I was only familiar with the conventional forms of birth control that are available, birth control pills and IUDs and depot shots, etc. So I was sitting there writing these orders and these prescriptions when my senior resident, Dr. Pearl Huang, decided to use this as a teaching opportunity and a teaching moment to talk to me about the different forms of birth control that are available and how they can affect the woman and the side effects and what she might experience, especially in the postpartum period, how it relates to her bleeding and her milk supply, etc. And as we were going through the different forms of family planning and talking about all the different side effects, she mentioned to me, well, did you know there are some forms of family planning that have absolutely no medical side effects? And I looked at her, I said, what are you talking about? Like every form of birth control has side effects. I mean, certainly the pill has, a whole host of side effects. But I said, even condoms can cause irritation and may make some women want to stop. And she said, well, yes, but there are natural methods where women can learn to observe, specific signs that she produces under the influence of her hormones that help her understand when she's fertile and when she is not. And she said, and women who just recently gave birth, well, they may not be returning to cycles right away and they may not produce these signs. There's another form of family planning called Lactation and Amenorrhea method that women can use, again, to plan her family without using any synthetic hormones or artificial devices to suppress her fertility, but rather learning about her signs of fertility. And I looked at her, I'm like, what are you talking about? I've never heard of this. And she said, well, yeah, women can learn to chart cervical mucus or check her basal body temperature. And I thought to myself, cervical mucus, the only thing I've ever learned about cervical mucus or cervical discharge is if a woman presents with that as a complaint, you need to rule her out for a sexually transmitted disease. And even if that testing comes back negative, you may want to treat her anyway, because, there's a high likelihood that's a false negative. And so go ahead and treat. And I thought to myself, I never learned anything about normal, natural, healthy cervical mucus that's produced on the influence of hormones. So here I was, a first-year resident, learning about these methods for the first time. And I thought to myself, my initial reaction was one of shock, like, how have I not heard about this, before? And that shock quickly turned to anger, because I thought to myself, here I am, a physician, an MD, passionate about women's health. I'm a woman myself, having, cycled for nearly 20 years. Why didn't I learn about this in medical school? Why didn't I learn about this when I was in college being put on birth control to treat painful periods, because that was all the doctor had to offer me? Why didn't I learn about this when I was 13 and I had first started cycling myself to better understand my cycles? So back in 2000, that night on call was transformational in my career, and it really motivated me to personally learn more about these methods. And then flash forward 10 years later, when I had the opportunity to teach a group of medical students about these methods, I thought to myself, this is an incredible opportunity to give them this gift of knowledge, this information that I never had as a medical student. And so I was very excited about the opportunity, but then reality set in. Here I was, a physician, a medical director running 2 community health centers with 30 people under me. I had 2 small children myself. I thought to myself, how am I going to create an entire course and teach on top of all of my other responsibilities? So I deleted the email and thought to myself, well, that's good, but somebody else can do it. I don't have time. And a week later, my friend emailed me back and said, we're still looking for people. And I thought to myself, I really should do this. And I'm thinking, no, I really don't have time. And it was like, the devil and the angel on the shoulder saying, do it, don't do it. And I thought to myself, I really can't. I just don't have time. And I went to hit that delete button when that angel on my shoulder said, no, you are the one that needs to do this. Because if not you, then who? And if not now, then when? And so I said to myself, okay, if I can find other people that are willing to work with me on this course, then I will put it together. So I reached out to some colleagues of mine at Georgetown. They have the Institute for Reproductive Health, where they developed the lactation and amenorrhea method, as well as the standard days and 2-day method. I reached out to Dr. Hannah Klaus, who's done work in the field of natural family planning since the 1970s, very active in the Billings ovulation method, developed TeenSTAR. I reached out to folks I knew in the field of, in the symptothermal world. Long story short, I had 9 students who signed up for the course, which was fantastic because we cap it at 10. And I had 12 people helping me to teach this class, which was amazing. But the best part was the feedback from the students. When we got their evaluations at the end of the semester, their comments were like, this was the best class I had at Georgetown so far. This is like fundamental clinical information that every woman should know. One student said, this information was the most practical, the most relatable to me as a woman and to my future career as a family physician. And another student said, this is something every medical student should learn. And I thought to myself, you're right. This is something every medical student should learn. And it's great that I have the opportunity to teach this information in medical schools at Georgetown, but how can I reach students from even more medical schools. And so with that, I kind of thought about it and was connected with another family physician, Dr. Bob Motley. I was introduced to him by Dr. Ann Nolte, founder of the Gianna Centers. And Ann had also done her residency at Lancaster, where I had trained. And she introduced Dr. Motley and I, and he was also passionate about teaching future physicians about these methods. And so together, Bob and I started FACS, the Fertility Appreciation Collaborative, to teach the science. And it's under the umbrella of the Family Medicine Education Consortium, which is dedicated to promoting primary care and family medicine. And it's been 10 years, and it's been an incredible experience, not only because of the work we've been able to do to reach medical students, but health professional students from all walks, as well as residents and healthcare professionals, about the science supporting the use of fertility awareness for women's health and family planning.
Dr. Duane, you are amazing. You are amazing. Oh my gosh. Such a beautiful story, and props to you, just saying yes, saying fiat, like the way you described that moment of devil on one shoulder, angel on the other. That's just beautiful. And I think sometimes about our feminine genius, we have this ability to be receptive. I believe when a faith circumstance or happenstance happens, that we have this ability to receive it, but we also can say no to it. You could have deleted it, and we wouldn't be having this interview right now.
Yeah.
If you had. Oh,
I know. And then I think about all of the women and all of the men and all of the medical professionals who would not have access to this information. And, certainly 2020 has been a challenging year for many, many people. But for FACS, it's actually been an amazing year, because I started teaching this elective in 2010, and I continued to teach it every year. I took one break after I had my third child in February, and was like, I can't go back to teaching in March. And that was the only year I took a break. But the next year we started teaching it remotely to medical students at UT Southwestern. And we got a whole group of students there excited and passionate about it. And then in 2017, I was able to get a very small grant, because although I've been teaching this course at Georgetown for 10 years, we do not receive any funding from Georgetown. My position there is as an adjunct. So all the work I do as volunteer. So all of the support for FACS has come from generous donors and through some grants we've been able to get. And in 2017 or 2014, I should say, I got some grants to record those lectures to create an online course, which we created in 2017. And we started reaching out and reaching medical students all across the country. And then it was a year ago in December that I said to Teresa, she had been helping me just with some of my own patients, and we would have these occasional calls to discuss these patient cases. And I said, Teresa, what do you think if we invited some of my students to sit in on our discussions? Here I am talking about this case. What would you do? I mean, Teresa's got tremendous experience in this field for 20 years, and I really, value that. And she said, that's a great idea. So in December, we started doing these online case study discussions, and we started inviting students who may not have the opportunity to observe medical professionals in their community, because there's such a shortage of medical professionals that are knowledgeable about fertility awareness, which is why we formed FACS.
Mm-hmm.
But we started doing this in December. In January and February, we were up and rolling, so that when the pandemic hit and everything went online, our course was fully online. So in January, February, March, we had 2 to 3 students, a block taking our elective. By this fall, when we launched our new elective, we now have tripled our enrollment. So in the fall, we had about 20 or 30 students complete the elective. This past fall, we had over 80 students complete our elective from all over the country. So it's so exciting to see how, when my colleague, Dr. Pearl Huang Ramirez, planted that one seed when I was a resident, how that grew into my experiences at Georgetown, my connection with Dr. Motley and starting the elective, and how that grew into FACS. It's incredible to see, if you continue to, nurture it, water it, feed it, how it can continue to grow and have a tremendous impact. And it's so encouraging to hear from the students now, and the effects that they're having through the conversations they're having with classmates and colleagues, and even faculty who may not be familiar with these methods and their important role in women's health.
So I have a question, Teresa, before you ask your next question, because I know you have one in your mind. For people listening right now, I'm saying this now because I'm afraid I'll forget at the end. If there are medical students now and people who want to be in on this call, how do they do that? What's that process like? And we can also include information in the write-up as well.
Sure. So certainly visit our website, factsaboutfertility.org. There's a tab called Learn More, and for students and residents, they can enroll in our elective. We currently do those live case study discussions as part of our elective, but we're excited to announce in 2021, we are going to be releasing a new continuing medical education course for medical professionals. So we're not limiting this information just to students and residents. We want to make sure that we're offering this information for physicians and nurse practitioners and midwives, pharmacists, physician assistants, physical therapists, whoever wants to understand this information. As part of the CME course, they will also have the opportunity to participate in these live case study discussions to see how we apply this information in the real world with actual patients to improve their overall health, and help them to plan their families based on their goals, whether they're hoping to prevent pregnancy for a little while due to personal or health concerns, or whether they're trying to achieve pregnancy, whether they're trying to get a better handle on their PMS symptoms or more effectively manage their polycystic ovarian syndrome. So stay tuned. The CME course will also be announced on our website, factsaboutfertility.org. And I would encourage every medical professional interested in this topic and student to join FACTS as a member. We send out a weekly blog, which will oftentimes summarize some of the latest research in the field. We'll feature patient stories and their experiences, both personally and with their medical professionals. So it's a great opportunity to learn more and to stay connected with the work that we're doing. And of course, this past fall, we held our very first virtual conference, which was a huge success. So we're planning another virtual conference for May 14th and 15th of this year, featuring a wide range of topics in terms of using fertility awareness, again, to enhance and improve healthcare for women.
Thank you so much.
Yeah,
everyone jot that information down. Don't forget. And we'll link the information in the description.
I love it when, I'm with a patient and you get that eye-opening experience, like they've never learned this information before. And Jamie knows that too, just from being a charting teacher, but it's even more exciting when you have a fully trained medical professional, doctor, nurse practitioner, physician assistant, pharmacist, whatever it is, and they've never heard this information, because again, it's just kind of this thing where you're like, how did we go through all of this schooling, years and years, and especially doctors who spend their entire lives in research and science and studying, but this is such a missing piece. And it shouldn't be, because our reproductive systems are so essential to everything, but the way we teach the reproductive system is so backwards in a way. We don't start with the actual function of the body and what's normal and how to see it as a vital sign to our health. We teach it as if, okay, we'll tell you the little bit about how it works, but it's really all about controlling it, and then we've got this thing, all of these synthetic hormones and birth control that we can use to do that. So it's just so awesome that, especially even in where we are in 2021, that you can reach so many people with technology that we have today. That's so exciting to me too. And just even our podcast, being able to share this information with thousands and thousands of people, like, praise God. There's really a blessing in that. So I love doing the case studies with you, Dr. Duane, because I love, again, watching these medical students see the practical application of this, because we even know that if you go through a training, if you go to learn even to be a medical consultant for NAPRA technology, that's a heavy, intensive training, but you come out and you're kind of like, oh, now what? To actually sit in front of a patient and know how to treat that patient is a whole different thing than having head knowledge.
Right.
And so I think these case studies are essential for putting it all together to be like, okay, this is how you use the charting to diagnose, to evaluate, treat, and now you can truly go out and be empowered to do this as a provider. So I love that.
Right. Yeah, no, it's so important. And it's critical because, as I said, there is such a dearth of medical professionals and physicians that are trained in natural or fertility awareness-based methods. And the stark reality of that hit home for me when FACTS was working on a research study. We had developed a shared decision-making tool that describes the different evidence-based fertility awareness methods that women could choose from. women go to the doctor, they go for family planning. Many women are not offered the option of natural or fertility awareness-based methods. And the reality is they don't need their doctors to be able to use a natural or fertility awareness-based method. They need a good educator like you, Jamie, or any of the educators trained in any of the modern methods, but they should know what their options are. So FACS developed a shared decision-making tool. So if a woman decides, you know what, I'm tired of the side effects of the hormones, or I don't really like the idea of having a device inserted in my body and walking around with that for 5 years, or I'm really focused on health and eating right and not putting anything artificial in my body. So I'd like a natural option, or I'd like to be able to use something that allows me to work with my body. They need to know what their options are when it comes to natural or fertility awareness-based methods. And the reality is there's not just one. It's funny, when we survey students and medical professionals, they often think there's only one method, and most medical professionals think the only method is the rhythm method. Still, 80 years later, after the rhythm method was developed, and at its time in the 1920s, it was a major scientific advance, but that was nearly a century ago. Since then, modern methods have been developed, first starting with the Billings ovulation method in the 60s, and then the symptothermal method and the Creighton model and the Marquette method and the standard days method. And yet most medical professionals aren't even aware that all of these methods exist, let alone are able to offer them to women because they don't know. So FACS developed this shared decision-making tool, and we were planning to test it in a research trial. So we wanted to identify medical professionals that were already knowledgeable about or trained in fertility awareness-based methods, to invite them to participate in the study. So we did a search, we searched the internet, we contacted each of the major fertility awareness and NFP organizations and asked them, please give us a list of all of your medical professionals, physicians, nurse practitioners, PAs, midwives that are trained in or knowledgeable about your methods. And when I say we scoured the internet, we scoured the internet. And do you know what that initial list of FABM trained or knowledgeable medical professionals, do you know the number of physicians and medical professionals we identified as our starting point? Any guess?
Yeah, what's your guess, Jamie?
10, 100, 5, I don't know.
I would guess somewhere between, I'm tempted to say 75 to 150, somewhere right in there.
There were actually about 600, right? Because we got all of the Creighton medical, well, that's actually not that many. We got all of the Creighton medical consultants, right? I mean, how many doctors have Creighton trained, right? Symptothermal had a bunch of doctors that were trained, but they were trained because they took the course as a patient. So when we started contacting those 600, we would get like, oh yeah, I know the symptothermal method, but I'm a radiologist. Like I took the course, with my wife when we were using it for family planning, but I don't use this in my practice, or I'm a pathologist, so definitely don't use it in my practice, or I'm a cardiologist. So these are doctors that may have been trained in the methods, but weren't actually using them in practice. So we actually narrowed it down to about 300 to 400. Now, if you think about that, there are 300 million people in the United States. To have only 300 to 400 doctors that are trained, it's a wonder that most women have to drive a half hour to an hour or more to be able to find a doctor that is knowledgeable. In fact, in DC, we talked about my direct primary care practice. Even though I moved to Utah this summer to do this fellowship for the next 2 years, 90% of my patients stayed with me. And I've still accrued more patients since coming to Utah, patients from DC, because I am the only physician in the nation's capital trained in any natural or fertility awareness-based methods. Okay, if our nation's capital only has one doctor and she's currently in Utah, I mean, what does that say about the state of healthcare and availability of these methods to our patients? And this is why FACS is critical. I firmly believe that the number one barrier to the widespread use and adoption of fertility awareness-based methods by women is the lack of medical professionals knowledgeable, trained in, or at least supportive of these methods. We did another survey where we surveyed women about their experiences talking with their clinician about their use of fertility awareness-based methods. And 30% of women said they had a doctor that laughed at them, mocked them, or scoffed at them for the fact that they were using a natural method. Now, I ask my colleagues, when is it ever okay to laugh at a patient for their choice of their healthcare? Now, we may not always agree, right? I mean, as a physician, we're currently, in the midst of the COVID pandemic, and the vaccine has just come out, and there's all this debate about taking the vaccine or not taking the vaccine. I would never laugh at a patient if they chose to not give their baby hepatitis B at birth. I would explain to them the reasons why it's indicated, their options in terms of when they could administer it or not. But and even if I may not agree with the choice my patient's making, I'm not going to make fun of them for that choice.
Right.
That's not going to help develop a healthy therapeutic relationship. In fact, I've had patients who have chosen to delay all kinds of vaccines that I've subsequently enabled them or encouraged them, convinced them through dialogue, through shared decision making, to in fact vaccinate their children, right? So as a physician, as a medical professional, we need to engage in a shared decision making process and an educational process, and we need to support women. And if you as a medical professional do not understand this method, you may think, well, you can't use a natural method because you have irregular cycles. Ask them why they're using it. Maybe they can explain to you, well, with polycystic ovarian syndrome, using a natural method has really helped me get at the underlying, factors that affect my cycle. It helps me better manage my cycle. Charting my cycle serves as a vital sign that helps me better understand, monitor, and manage my health. So to my medical professional colleagues, I was with you. I was one of those doctors that did not know that there was such a thing as normal, healthy cervical mucus. I still shudder to think at how many women I treated for sexually transmitted infections who simply had normal, copious amounts of fertile cervical fluid that I had never been taught to recognize as natural. So I understand from my medical colleagues, you may not understand this, but do not discourage your patients. Rather, I would encourage you to challenge yourself to learn more. FACS serves as a foundational organization. Part of why our focus is on the medical student and the health student community is we want to provide that foundation. We provide information about all of the modern evidence-based methods so that you can have an informed conversation with your patients about these methods. We encourage those medical professionals and physicians that really want to go to that next level and they want to implement these protocols in their practice, and they themselves want to actually actively treat women by using the chart as a diagnostic tool. We encourage them to then pursue additional training as a medical consultant, whether it's through Creighton or FEMM or Neo-Fertility, whether they are interested in becoming trained as a Marquette teacher or a symptothermal teacher. We encourage them to take that next step. But FACS is here to, as you said earlier, Teresa, to bridge that gap between the patients who are so knowledgeable about what's happening in their health with the medical professionals who may not have a clue or really understand why the chart is such an incredible, valuable tool that, again, serves as the fifth vital sign of health for women.
There's something, as you're talking about this, in an earlier episode, we talked about the power frame, like the power that a physician has with their patients, and how, as you were saying, 30% of the physicians or the client experiences that you were, bringing in or surveying, that they were mocked, when they told their physician about their choice to use natural systems. And I was one of them too. And at the time, I went to the doctor, told her I was doing NFP, and I was doing my big research paper where I knew I was right. I knew that this was legit. I knew it was effective. But if I wasn't doing that, it's very likely she would have talked me out of it because of the power frame, because of that power that a physician has. And young women, even no matter how they're formed, I mean, if they're formed knowing that there are better options, of course, they're less likely to choose a less best option, even if it's from a physician. But if there's no formation, then of course that's what that's who we're going to believe, because doctors are smart, and we're trained to think doctors are smart, and we're not. So we're going to believe what they say. Yeah.
Go ahead.
I was just going to ask you, I was going to say, or make a point of saying, and maybe you could expand on this. A lot of questions we get from women, when we offer this as an option or solution. Well, my doctor, they don't know about that. Why don't they know about it? Why do you? It's because of that power frame. So do you want to expand a little bit more on that for all the women thinking, well, I trust my doctor and they're not offering that? What's advice that we can give to those patients?
Great question. And I want to start first by saying you are not alone. I was actually that patient too. When I had my third child, after the birth of my third child, I went to see the midwife for my postpartum care. And I had gone to this practice of midwives, and this was the first time I was seeing this midwife. Now, this was in 2012. At this point, I had been a practicing physician for over a decade. I was an adjunct associate professor at Georgetown, and I had founded FACS.
Yeah.
And when the midwife asked me, well, what are you going to use for family planning? I explained to her, well, currently I'm exclusively breastfeeding my child and really following the principles of ecological breastfeeding, but I plan to use the lactational amenorrhea method, for the first 6 months. And then I will begin to look and, begin observing for my cervical mucus signs again and continue using a natural method. And her response to me was, well, I know women that get pregnant doing that.
Mm-hmm.
And I thought to myself, oh my goodness, if she can say this to me after I just explained all of this. And I thought to myself, how would I feel if, like, to your point, Jamie, I didn't have this knowledge and I didn't have this power? I might have been discouraged, so like, oh, well, then what do you think I should do?
Yeah.
And I was so angry because I thought to myself, it's not fair that other women might not have that. And I thought to myself, she was late seeing me because she was struggling to get an IUD in the patient before me. And she had said that when she came in, she's like, oh, I'm sorry, that IUD procedure took a little longer, to place. And I thought to myself, did you make that same comment to that patient that you made to me? Because I've seen women get pregnant using the IUD too, So, this disconnect or this disequilibrium or this unequal approach to the way we talk about family planning. I mean, the true nature of fertility awareness-based methods is it does not suppress your symptom. Women learn when they're fertile, when they're not. They can use this information. If they have sex when they may be fertile, it's highly likely that they may get pregnant. We accept the fact that pregnancy is a consequence of sexual relations if we have sex when we're fertile, right? Whereas with conventional forms of family planning, we convince women, well, if you're taking the pill, you're on birth control, you're not going to get pregnant. Well, the reality is the birth control pill has an effectiveness rate comparable to most commonly used forms of natural methods of family planning. And so, but we don't tell women this, right? There's this disconnect. But to your earlier point, yes, women, it is difficult for women when they feel like, well, my doctors know better. Let me tell the women and the couples and the men that are listening to your podcast, most doctors don't know better. Most doctors do not learn about this. In fact, there was a study in 2010 that surveyed family physicians and obstetrician gynecologists, the physicians that provide the overwhelming majority of women's health care. And they discovered that only 3 to 6% of family physicians and obstetricians gynecologists were familiar and knowledgeable with modern methods of family planning, including the Billings ovulation method and the symptothermal method, just to name a couple. So the reality is most doctors, most midwives, most medical professionals do not know this because they do not learn about these methods. And so again, FACS is trying to be that bridge and to provide these resources. And in fact, we have a resource available called Share the FACS Folder, which people can order online from FACS and give to their medical professional the next time they're challenged. And you don't feel like you can say, like, we include evidence-based articles talking about the effectiveness of these methods. We include our shared decision-making tool, which describes the different methods that women can use, so that you can have a tool that you can give to your doctor or your midwife and say, I know you may not be familiar with these methods, but here's some information from a medical education organization whose mission is to educate about the evidence underlying these methods, right? It takes the pressure off of you and say, like, I'm just a patient, but there's this medical organization. Now, to be fair to the patients, I know you are super smart. I tell women this all the time. You're smart. You're smarter than your smartphone, which is why I tell women, learn a method, learn to observe your own signs. Don't rely on your app to tell you. Use your app to track if you want, but you're smart. So I don't want to in any way dismiss the knowledge of the women that are listening, especially those that have learned to chart their cycle with fertility awareness-based methods. But I simply want to offer this resource as a tool to help you have that conversation with your clinician, so you feel like you've got some backup when you're going into that exam room, when you feel like they may challenge you on your use of a natural or fertility awareness-based method.
Yeah, that's awesome. That's an incredible resource, Dr. Duane. I did not know that was available for people. So that's incredible information. I mean, information is at everyone's disposal. And like you said, my patients are more educated than they have ever been. I would never, I mean, I listen, I learn from my patients, and they understand that things do need to be backed up by science. And because because natural methods of fertility have gotten scrutinized so much, we do need to be backed up by science. And the work that you have done is just pivotal. It's foundational. It's really the most important thing we need to be able to carry this information to other, to patients, to providers, so that we feel like we're standing on solid ground.
Right,
So that's
right.
amazing. Hey,
But
Dr. Duane, real quick,
can I just make a point? I just
Yeah.
wanted to make a point with regards to the research. You're right. We absolutely need the science. And the reality is there's not a ton out there because doing research takes money. And the reality is there's not a lot of funding. Again, most of the research FACS has been unfunded. So it's taking us time to get it out there and get it in the medical literature. But that's a large part of the reason why I decided to move my family across the country in the midst of a pandemic to do a research fellowship in fertility awareness and women's health with Dr. Joe Stanford, who's one of the preeminent researchers in the field of fertility awareness. So just because the evidence isn't published doesn't mean it doesn't exist, doesn't mean it's not true. We simply need more funding for this research. The reality is, though, there's not a lot of organizations. Pharmaceutical companies certainly are not motivated to invest money into researching how natural methods are going to work when women and medical professionals are convinced that the pill is the panacea for all that ails women, right? So pharmaceutical companies literally and figuratively make a killing off of the birth control pill, which is the most commonly prescribed medication, given to a healthy woman, and or to treat a wide variety of medical illnesses for which it's not technically medically indicated. So there's a significant lack of funding for research. We need more research, and I encourage my colleagues to consider pursuing these avenues. And for funders out there, for donors, consider giving to organizations like FACS and the International Institute for Restorative and Reproductive Medicine and other groups that are trying to do the research to further develop the base of science supporting the use of these methods. And again, the role of the chart as the fifth vital sign for women.
I make that point all the time. It's so important. And we need other people to say yes, like you have, because if people want this information, if they want the research, someone's got to say yes to it. And I know it's a lot of hard work, as Dr. Duane has shown. She's put so much effort into it, but we definitely need other people to hear that and to be inspired to, take that next lead. And the new generation, we like to say in the podcast, like, we're inspiring a new generation of women to be the genius of their own hormones. And that takes science to be at our side. It's not without science that we can do this. And science is ever changing. It's not something that is black and white, yes or no. It is ever changing. And that is because research is ever changing and moving us in directions that tell us where truth is in science. So I hope you've inspired, some new people in this area to really take charge and to take up that call. So
I hope so too.
Yeah, thank you so much. So lastly, as we wrap up here, Dr. Duane, and thank you so much for spending the day with us this time. What is a piece of advice that you would give to young women to be the genius of their hormones?
Great question, Jamie. One thing that I am a big believer in is I think every woman should learn to chart at a very young age. I'm a mother of 4 children. My oldest daughter is 12 years old. We're already starting to have that conversation about the changes she's experiencing in her body and what she can expect when she begins cycling. And I think for young women, it's not too late. Even for older women, it's not too late, even as you're beginning to go through the perimenopausal changes. But I would definitely encourage young women to learn to chart. I mean, for so long, we've thought about natural methods as natural methods of family planning, and they're for family planning only. But we use the term fertility awareness-based methods because we want to highlight it's so much more than family planning. It's being aware. And at FACS, we use the term appreciation, being aware and appreciating the way your body is designed. So for young women, I would encourage them, learn to chart your cycle, learn to better understand your health, learn how your chart can serve as a fifth vital sign to help you monitor and manage your health. And do not be afraid. Do not be afraid of doctors that may not be as knowledgeable as you. Do not be afraid of sharing this information. Again, if it had not been for Dr. Pearl Huang, who, very gently and kindly shared the information for me, it might not have opened my eyes to it. So just be confident in your conversations with your clinicians. Explain to them, this is what I'm doing. This is why I'm doing it. When they ask you when your last menstrual period is, say, well, my last menstrual period started this such and such a date. Oh, and my cervical fluid phase lasted from this day to this day. And they may look at you like, what do you mean your cervical fluid phase? And explain, oh, well, I chart my cervical mucus, so I understand like when my estradiol was rising. As soon as you start throwing out terms of hormones, they're gonna be like, wow, well, okay, glad to know that you know that. And they may think, I don't know what a cervical fluid phase is. At FACS, we teach our students and our colleagues to learn to read the chart of the female cycle, like they learn to read an EKG. And we teach them, like, as women, we learn how long is your menstrual cycle, when did your period start, and how long is your overall cycle. But we teach the students, look at not only the menses and the cycle length, but look at the cervical fluid cycle length and look at the luteal phase length. I think it's fantastic when a woman can go into her doctor and say, like, wow, I've been charting my cycle for a year. My luteal phase has gone from like 14 days to 10 days. And I'm really concerned about what that might mean for me. And they may be like, how do you know this? But show them that you know. And again, do not be afraid to share this information. And if they're like, if they're like, I don't know about this, say, well, if you want to learn more, visit factsaboutfertility.org. They've got lots of great resources. We do 2 webinars a month, one on fertility awareness for family planning, one on fertility awareness as the 5th vital sign. So encourage your clinician to check out a webinar, check out our virtual conference in May, check out the CME that we're offering so that they can learn more and be empowered, so that they can in turn educate and empower women and men to really take charge of their fertility and care for their bodies in a holistic, restorative manner.
Thank you so much. Oh my gosh, Dr. Duane, thank you for just gracing us with your presence and inspiring us all. I'm sure every listener is like going to go visit your website right now.
Well, I hope so. And thank you for this time. I love doing podcasts. I was super excited when you all started your podcast. I've done the Fertility Friday podcast a couple of times in Pursuing Health. And I think it's so important to share this information. So I encourage your listeners to share this podcast with your clinicians, with your friends, and encourage more women to really embrace the power of the female cycle and really understand their hormone genius. It's wonderful what you both are doing. So thank you.
Thank you, Dr. Duane.
Thank you so much. Yeah, this has been just a really inspirational podcast. So thank you, Dr. Duane, for your time.